In today's video, let us examine this emerging trend of long-term COVID. It is seen that in a sizable amount of people, some symptoms of COVID-19 still persist even though majority of the symptoms have passed away. I will leave a link to the symptoms of COVID-19 towards the end of this video. I am Dr. Rohan Fonseca. Through this channel, I would like to spur you to better health and fitness. If you are new here, please do consider subscribing. It is well known that after a viral infection, some people continue to show signs of the disease even though majority of the symptoms pass away. This seems to be an emerging trend in COVID-19 as well. A lot of the patients who look for supportive help are not getting it. This is probably because we ourselves do not know enough of COVID-19 to provide you with the supportive help. The number one symptom that seems to be lingering on is that of acute fatigue. Looping up a chart, it shows a breakdown of all the symptoms. Just to clarify on a couple of the scientific terminologies used in this chart, Zika syndrome is an autoimmune disease, also known as Sjögren's syndrome. This classically combines dry eyes, dry mouth, and a connective tissue disease. Vertigo is a sensation of feeling giddy and the world spinning around you. It is noted that nearly 87% of the population suffering from long-term COVID complain of acute fatigue. Some of the symptoms we have noticed in India which linger on include shortness of breath, loss of smell and taste, joint pains, body ache, and GERD. Most serious long-term complications of COVID-19 include scarring of the lung tissue, organ damage, and damage to the blood vessels. Listen to this part of the video quite carefully. According to cross-sectional data collected from the NHS using the COVID tracker app, it has been noted that at least 1 in 7 people will suffer from long-term COVID for up to 4 weeks. 1 in 20 people will suffer from long-term COVID for up to 8 weeks. And 1 in 50 people will suffer from long-term COVID for up to 12 weeks. The predictors of long-term COVID appear to be connected with the length of the disease. People suffering from symptoms for 11 days or less are less likely to suffer from long-term COVID. People over the age of 70 are twice as likely to suffer from long-term COVID. Other risk factors for long-term COVID include obesity, comorbidities, and asthma. Do share this video so that it can reach and keep more people informed. And a subscribe would be nice. I'll be seeing you in the next video. Until then, signing out, Dr. Rohan Fonseca.